Hello, and welcome to Arnold Palmer's Critical Care Transport Team ambulance. This ambulance here was received with funds donated through Children's Miracle Network. So if you see any of the balloons out in the community, such as Dairy Queen, Publix, Walmart, where they ask you to donate money, here's one of their causes. Primarily, most of our funds are raised through Children's Miracle Network events around town. We have our own Children's Miracle Network team that works here at Arnold Palmer Hospital. This unit here is a 2005 International. It's the smaller of the three units that we have here at Arnold Palmer Hospital. Arnold Palmer Hospital is Central Florida's premier children's hospital. We are Central Florida and Orlando's only U.S. News and World Report rated hospital in Central Florida. We are also Central Florida's trauma center, which means if you have a critically ill patient or child, more than likely they're going to be transported here to Arnold Palmer for their best care. We are a level 1 trauma center, which means that we have to have all specialties available to you, the public, 24 hours a day, 365 days a year. This ambulance here is used to mostly transport acutely ill patients. If you have a child that you desire to go to Arnold Palmer from any of the surrounding facilities here in the greater Orlando area, Health Central, Dr. Phillips, South Seminole Hospital, and South Lake Hospital out in Claremont are our sister facilities here at Arnold Palmer Hospital. We are part of the Orlando Health Care System, and those are our sister facilities. Some of the other facilities in the greater Orlando area that we pick up quite frequently are from our Central Florida Regional, Osceola Regional, and we have a contract with Nightlight Pediatrics. So if you bring your child to an outlying facility and they are by law required to stabilize your child and then transport them to have them transported or brought to a appropriate facility for their sickness or injuries, since you have pretty much three choices here in Orlando for pediatric care. You have us here at Arnold Palmer Hospital. You have the Children's Hospital at Florida Hospital in their Florida Orlando campus. They also have a pediatric emergency room at Florida Hospital East. And then if you are in the southern area of Orlando, you have Nemours Children's Hospital. Both of those hospitals are great hospitals, and all of them have emergency rooms, but not all of them are certified as a trauma center. So if they have a car accident on I-4, they are more than likely going to be transported here to Arnold Palmer Hospital because we are the best facility to take care of your child. Arnold Palmer Hospital is over 20 years old. It used to be Arnold Palmer Hospital for Women and Children before Winnie Palmer Hospital, which is our sister hospital built across the street, which is now Winnie Palmer Hospital for Women and Babies, which carries all of our OB specialties. and if the child requires a neonatal intensive care, you can find that over there at Winnie Palmer. They also have transport team over there. They have 2 units that are staffed 24/7, 365, like the units here at Arnold Palmer. Like I said, this is the oldest and smallest of our units, but it does carry all of the necessary equipment that you would find in the hospital on it. We can pretty much transport any child from the outlying facility, regardless of their illness, as quickly as possible. If they are in dire need of emergency care, Orlando Health does have 3 helicopters strategically placed around the greater Orlando area, but they are limited by weather, so if your child is critically injured and the helicopters cannot fly, they utilize one of the 5 ambulances that Orlando Health owns to transport them if they are a pediatric or a neonatal patient. We'll give you, I gave you a once around the truck here. I don't remember if I did or not, but we will take a look around this truck real quick and I'll show you some equipment. We have the captain's chair here, which is the chair that the person that's doing airway control sits in. We have our LifePak 15, which is our cardiac monitor and defibrillator unit. We have a refrigerator to carry refrigerated drugs. We have pumps for delivering medications, IV bags, a chair for a paramedic or a registered nurse, another chair for that. And as you can see here, we have cabinets filled with medical equipment and books and stuff. And then we have our critical care stretcher here with all of our stuff. As you can see, we have Nemo on this truck. So we are a child-friendly ambulance. And if we have any questions, I'm more than willing to answer them in an email, and we will talk later.